So Eli Lilly came out with Prozac in the 1980s, and they had to explain how it worked. So they made up this complete lie. There was no backing to it. There was no research behind it. They went, well, Prozac's a chemical, and the brain is full of chemicals, and it does something to the serotonin, which they didn't fully understand. So they just made up like, oh, our drugs treat a chemical imbalance in the brain. If it's treating a chemical imbalance, then it would seem that the psychiatrist would need to know which ones of those are out of balance and by how much. What's the baseline? What tests are they using to figure out which ones are out of balance and by how much? And I'm watching, and none of the psychiatrists are using any kind of test to find any kind of baseline. And I'm like, well, why is that? And I asked one, I said, well, listen, this is caused by a chemical imbalance of the brain. How do you know what's out of balance? By how much? Oh, the drug companies take care of that. We just follow their recommendations. And those drugs don't cure anything. They're treating symptoms. They're tamping down symptoms. At the same time, the global antipsychotic sales in the U.S. have soared to $14.54 billion in 2021. I'm not talking about million. I'm talking about billion. These people are making a fortune on selling these toxic drugs that have horrible side effects, and actually are shrinking the brain and causing neurological damage with long-term use. So they found that out when they started doing autopsies on long-term psychotic patients in state hospitals. Once they started cutting them open after they died, they looked at their brains and they saw they were shrunk like walnuts. And they went, hey, the only difference is that they've been on these antipsychotic drugs. Otherwise, they've been treated like all the other mental patients under the same circumstances. So it must be the antipsychotic drugs. So these were, reputable researchers. So they put out a paper. Now, if the APA found out about that, they would have blocked that paper. The drug companies control the universities. So they block anything that goes against their interest. They would have blocked a paper like that. But this one got out. And when the psychiatrists and the psychiatric mafia found out about it, they went, oh, no, it's not our drugs. It's the schizophrenia that's doing this to them. So the researchers went, no, we're seeing this over and over again. So what they did is started feeding those same drugs to rats and monkeys and mice and found that the same thing was happening. Their brains were shrinking. There was permanent neurological damage to not only their central nervous system, but also their peripheral nervous system. Irreversible damage, the drug caused by these drugs with long-term use. And I never saw a psychiatrist ever tell a patient about the dangers of these drugs. The side effects of those drugs start with a neurological tremor, and then they move up to tongue darting, where the tongue is going, nah, nah, nah. They can't control that. All right. So they're making billions of dollars on the sale of these antipsychotic drugs to cure absolutely nothing, tamp down symptoms, and they're telling the patient that there's a biochemical imbalance in their brain, and they're still doing this even though it's been disproved over and over and over again. Same thing with antidepressants. The antidepressant market is expected to reach $15.98 billion by 2023. Billion. So what you have here is a mental health system that's based on a lie. Not only are those diagnoses that they spit out completely fabricated, there is not one single objective test to measure any of those diagnoses at all. They're all subjective. They're all made up by a team of 13 psychiatrists or so that meet once every few years, 2/3 of which are associated with the drug companies, and they make up these psychiatric illnesses. That whole DSM, which is their Bible, is a collection of made up, fabricated mental illnesses.